Hi everyone, I'm Dr Yusra, skin aging expert, science nerd, and skincare mythbuster. Welcome back to my channel where today we're spinning the serum on skincare scams. Yes, the products that make big promises, burn through your bank account, and then ghost you when your skin breaks out. These are the top nonsensical skincare fads that are basically just skincare snake oil. Now I'm going to explain why with a healthy dose of science and a sprinkle of sass. I'm going to separate skincare fact from fantasy and expensive fluff from actual stuff. If you've ever bought into something shiny, gold-plated, or peddled on social media, this one's for you. Number one of the things that really irk me, something that's gone wild on social media, is jade rollers and crystal tools promising to help you anti-age without any injectables. Now, listen, these are cute. And yes, if you stick them in the freezer and you take them out, they are cooling. They're all over TikTok. But if you think that a vibrating piece of quartz is going to drain your lymph nodes forever, then we need to have a chat. The science bit is, yes, rolling a cold object across your face can temporarily reduce puffiness by constricting blood vessels. That's called vasoconstriction. But can it detoxify your lymphatic system or reverse aging or lift your muscles or heal trauma? Honey, this is just a rock. A cold spoon from your freezer does the same job and it doesn't cost £40. Is a quartz jade roller going to make all the difference at lifting up your muscles? Absolutely, categorically not. The only thing that is going to be lifting is your hopes. You can absolutely crack on and do it. And yes, it can help temporarily with aiding with lymphatic drainage, particularly after you've had a treatment, but it's not actually going to cause any anti-aging impact. It's not going to lift your muscles, and it's one that I wouldn't really waste my time on. Number 2. Pore strips. Now, this went viral a few years ago where everybody was sticking this black pore strip on their face. They were getting it in a liquid form or a physical form. You stick it, you rip it, you stare at the gunk like you've achieved something marvelous. But here's the deal. Those strips only pull out oxidized oil and dead skin at the surface. They are not the stuff causing the congestion deeper in your pores. Every single one of you has sebaceous filaments in your pores. That's normal. The second you take them out, they refill again. That is part and parcel of the function of the pore. So stripping and pulling out sebaceous filaments is a waste of your time, and actually you could be impairing your barrier function and causing irritation. The science behind this, well, first and foremost, pore strips do not stop blackheads from forming, and repeated use can actually damage the barrier function of the skin. Worse still, if you have barrier function impairments, you end up with inflammation, broken capillaries, redness, blotchy skin. It is not a good idea. A better solution for those of you who have clogged pores, blackheads, congestion, is use a salicylic acid. This is a beta-hydroxy acid that is oil soluble. It's pore loving. It's proven to clean inside the pores. It gets rid of all that gunk, and it's anti-inflammatory. It actually comes from salicylate or aspirin. So it helps to reduce inflammation on the skin. It helps to break up oil. Fantastic for those patients who have lots of oil, lots of congested pores, lots of blackheads. You can use a low dose of up to 2% every single day if appropriate. Of course, you have to see a clinician to make sure that whatever you're putting on your skin has been chosen specifically for your skin type. But adding in a pore strip is going to be giving you diddly squat, jack holes, something that I would totally skip. If you want to stimulate cell turnover, my advice is use a retinoid where appropriate. So, verdict, pore strips are skincare theater. They're dramatic, they're fun, and they're ultimately fiction based on zero fact. Number 3, collagen creams. Lord above, you just walk around Boots, you walk around any pharmacy, and you'll have seen them. They have big jars that promise to rebuild your skin's collagen. Often they say with collagen in them. They usually come with a royal price tag and vaguely some kind of French branding. But here's the cold truth. Topical collagen cannot penetrate the skin. It's a nonsense. It's scientifically invalid. The molecules are too big. They just sit there like expensive moisturizing wallpaper. Lots of patients think that this is great for you because it feels good on your skin. Well, of course, it's going to feel good on your skin because they often have humectants in that moisturizer. They have added ceramides. They have ingredients that will hydrate your skin. They will make you feel good. It's called placebo. That's great. That's wonderful. But the collagen is going to do nothing for boosting your actual collagen content in the skin. So studies show that moisturizers, yes, will hydrate the surface of the skin, but they're not going to boost your dermal collagen. If you want collagen stimulation, you need to use a retinoid. You need to have microneedling. You should be using vitamin C or have injectables like polynucleotides. There are other things that you can have that are backed by decades of data, but collagen creams, my verdict, no. It's giving moisturizer, but it's not giving results. Number 4, 24 karat gold skincare. Okay, we really need to just labor on this a little bit. I love gold. Everybody likes a little bit of jazz, a little bit of glimmer, a little bit of jewelry. Who doesn't like something shiny? But you don't need gold in your skincare. I see lots of gold serum bottles with exaggerated glamour, but, clearly Cleopatra used nano gold in her 10-step routine. Is that right? No, it's wrong. There is zero evidence that gold does anything beneficial for skin stimulation, collagen stimulation, and if anything, for some patients, it can trigger allergic reactions. Gold was named a top allergen in patch testing by the American Contact Dermatitis Society. Now, of course, not all patients will be allergic to gold. Gold is relatively inert, it's luxurious, it looks awesome, but it's not actually doing anything for you. So keep the gold on your fingers, not in your serum. Number 5. I did an Instagram video about this and a TikTok video about this. It's called period blood facials. I wish I was joking, but I'm not. Yes, there are influencers smearing menstrual blood from down below on their faces in the name of skincare regeneration. It is wild. It is outrageous. I honestly, I'm speechless even rethinking that this is a trend, a fad, and something that people are following because unfortunately, social media has become a source of information for lots of people. And so if they see it online, they think that it's gospel, but it's not. These influencers putting period blood on their face claim that it's rich in stem cells and hormones, but spoiler alert, it is not. The science behind it. Menstrual blood contains degraded endometrial tissue. These are not viable stem cells. The hormones in blood are not stable enough to function topically. So can hormones help with skin? Yes, some hormones can help with skin, like estrogen. You can apply estrogen topically to help with improving skin barrier, collagen stimulation. You can use testosterone, propionate where appropriate for skin. But can you use period blood that is proposed to have hormones in it on your skin? No. There's no evidence that this works. And actually, the hormones that are in your period blood are waste product, they're end product. They are products that are being expelled from your body. This is not the same as PRP or PRF, where we are taking fresh blood from your blood vessels, putting that in a centrifuge, separating the red blood cells from the plasma-rich platelets to get all of the growth factors injected into your skin. That is very different to period blood. But worst of all, this is a huge risk. It's a risk to health. There is a risk of bacterial, viral, fungal infection for those who might have thrush. This is really something to absolutely avoid. This is not biohacking. It is a biohazard. Number 6, Instagram LED light masks. Okay, let's talk about this. They look cool. They glow. They feel like a robot Jedi. But unless your mask is delivering medically validated wavelengths and energy, is basically a disco for your face. So what does work? Does LED light work? Yes, LED light does work, but it has to be at certain wavelengths. You have something called electromagnetic spectrum, and this electromagnetic spectrum essentially describes or explains the different wavelengths of light that emit at a different color. So you have visible light, you can have red light, you can have green light, you can have blue light, and every type of light is absorbed by different chromophores on the body, in the skin, in the cells. So you have inside your cells a little engine or an energy-based little organelle called your mitochondria. And the mitochondria are very important for creating something called ATP, which is your energy production. Think of it like fuel for the cell, and your mitochondria is the engine. When you have red light being emitted, your mitochondria absorb that and create more ATP. So it can help with collagen synthesis, collagen production, reduction in inflammation. And we do use medical grade LED light therapy to reduce inflammation on our patient's skin after having a treatment where they might be red, like a CO2 laser or skin peel or microneedling. We can even use blue light at 415 nanometers for acne. These do have scientific evidence behind them, but the LED lights that work are only those that are precise, tested intensity. Most cheap at-home masks do not penetrate past the top layer of the skin. So my verdict is, unless it's medical grade, for all intents and purposes, this is mood lighting and something that I would not be investing in. If you do want to have an LED light treatment, think about having an LED light treatment that is medical grade that you can find in clinics, or invest in a medical grade LED light that you can use at home, but certainly none of these that are jumping off the back of scientific literature, that don't have CE marking, that are not FDA backed, that have not got any medical testing, to me is placebo effect and is doing jack all for your mitochondria or skin health. Number 7, let's talk about face mists. I've got one here. I do love a face mist, but is it going to make me 10 years younger? No, they smell like heaven. They work like a scented breeze for your face. They can add a little bit of hydration, but it's really important that you look at the ingredients of your face mist. If they don't have humectants, they don't have glycerin, they don't have hyaluronic acid, or an occlusive moisturizer to lock it in, that mist just evaporates and it's really no good for you. Some of them do have good ingredients like peptides, or they might have copper in them that can reduce inflammation or optimize collagen production. Some of them do have humectants in them that help to hold hydration in. But otherwise, if it's just lavender-based water, you're wasting your money and you absolutely don't need them. And studies show that repeated misting can actually cause transepidermal water loss, especially in dry environments. So my verdict is, it's cute for a midday refresh. I like it if I want a quick glow, a quick light up, but don't expect hydration miracles. So what does work? Science-backed MVPs, most valuable players or most validated products. There is no more validated product than retinoids. This is the gold standard for aging, for acne, for collagen stimulation. This is something that you can get in various different concentrations. Anyone that's telling you that retinoids will thin your skin is talking nonsense. They don't understand medical literature, medical science. They don't understand how to interpret medical data. All of the data shows that retinoids, retinoic acid, stimulates collagen production, reverses fine lines and aging, actually thickens the dermis by increasing the density of collagen in them. So they should be your go-to in anti-aging skincare. And this can be throughout the ages 25 and above. You do not have to stop them at perimenopause or menopause. You just need to find one that suits your skin. Using this is the holy grail. It is the most proven ingredient in the literature. If you had to use one thing and one thing alone, I would say a retinoid. Just remember, you cannot use it while you're pregnant or breastfeeding. Number 2, L-ascorbic acid or vitamin C. I've done a whole YouTube video and podcast on vitamin C. Vitamin C comes in various different types. They come in esters, they come in derivatives, they come in the most potent form, which is L-ascorbic acid. And which one you choose depends on your skin type. Vitamin C helps to fight free radicals in the environment. They help to protect your skin. They help with antioxidant protection. And they can even boost collagen. They can brighten, they can protect, and they can treat inflammatory pigmentation. Just make sure it's the right pH and right concentration, because not all patients can tolerate vitamin C. And in some patients, it can make inflammatory acne worse. Niacinamide. I love niacinamide. This is underused and underrated. This is my go-to for all skin types, whether you are pigment prone, acne prone, or sensitive or prone to redness. This is fantastic. It's an antioxidant that you can use in place of vitamin C or as well as at different times. It can reduce redness, it can regulate sebum production, it can strengthen the skin barrier. So it's fantastic for acne-prone patients and for patients who have any inflammatory skin condition, because it's going to improve that skin barrier function. Sunscreen, my friends, this is still the best anti-aging product you will ever own. This is something that you cannot skip. It's as important as brushing your teeth every day or putting on fresh underwear. Don't go out the house without sunscreen. You need a sunscreen on a daily basis between SPF 30 to SPF 50. Make sure it's broad spectrum, so that means it's protecting you against UVA and UVB. Again, I've done a whole YouTube video on sunscreens, the different ingredients out there. There's a lot of misinformation about chemical versus mineral, so we can link that down below if you want to learn more about sunscreens. And if you want to have an injectable that's going to stimulate your fibroblasts, polynucleotides, again, done a whole video on this. This is the future of regenerative skin science. It's been around for decades, and we are now using it in aesthetic medicine to optimize healing and actually help with regeneration of your skin. So here's my final thoughts. If it sounds like a fairy tale, it probably belongs in a crystal-infused Pinterest board, not on your face. Don't forget to like, subscribe, and tell me in the comments the weirdest skincare product you've ever bought. No judgment, unless of course it involved period blood. Then I might judge, just a little bit. See you next time.